This is Biomimetic Dentistry 2025, an introduction featuring Doctors David Alleman and myself, Saul Pressner. And as I said, I'm the president of the Academy of Biomimetic Dentistry in private practice in New York City. Okay, this is just a slide and a video, which some of us may be familiar with, of the cycle of tooth death, courtesy of Doctors Pascal Mann and Matt Najad. So we're just going to show you this, and I'll just narrate a little bit. For those who may not be familiar, it just illustrates what biomimetic dentistry is all about. So you can see here's a small class 2 interproximal caries lesion. And with traditional dentistry, as we had been taught, we were taught to remove the caries lesion, but in order to restore it, we traditionally used amalgam. We had to undercut the walls, and that often resulted in a fracture of the natural tooth structure adjacent to the amalgam, which led to even more invasive treatments, such as a crown. A lot of times when you do crowns on teeth, as we are all too aware, the result is the need for root canal therapy and post and core to retain the crown. But the problem is, when you have a post and core retaining a crown, the tooth is subject to more destructive vertical forces, and you can often get an apical fracture, like right down there. And when that occurs, unfortunately, the tooth is on its way out, and then the result is an implant. So we want to avoid this cycle of tooth death with biomimetic dentistry. And just remember, it all started out with a simple class 2 caries lesion, and thanks to people like Dave and Ray Bertolotti and others, we have much better ways and through adhesion of saving and restoring teeth. Okay, here's a slide of mine. Again, another class 2 cavity preparation. I try to have rounded line angles and make it as conservative as possible. Under a rubber dam, whenever possible, we try to use that for good isolation. And then this is just the final stress-reduced class 2 direct composite. So Dave, if you want to chime in at all, why don't you maybe chime in on some of the benefits of biomimetic dentistry, please, if you don't mind.
Yeah, let's, I'm glad that Ray Bertolotti is on this call, because he was my first mentor. The tooth is supporting the restoration. So even if they become unbonded in one area, they still have enough tooth structure to survive. That's the difference between adhesive dentistry and biomimetic dentistry. With biomimetic dentistry, we're now able to increase bond strengths, decrease stresses of the restorative technique to build walls that are missing, and subgingival portions of the root that are missing. And this really begins in 2002 with Simone Della Peri's landmark article in Journal of American Dental Association that shows us how to do this. And so you have Japanese, you have Italians, you have Americans. Somehow they have to talk to each other. And when they do, progress is made.
Yep. And this is actually a slide of yours, Dave, showing that a patient, we've all seen this, patient walks in with a crown in their hand, and most of the tooth is inside the crown, and the patient just wants us to re-cement it. But as you could see, most of the tooth is now in the crown, and in order to restore this tooth properly, you would either have to do crown lengthening and a new buildup, or you may have to extract the tooth. But I would guess, Dave, you would know better than me. It was your case.
Yeah, this is a good example. So this tooth actually didn't fracture off. It would have fractured off if the patient hadn't come with symptoms. So the patient said, I've got some pain on biting, and this is a tooth that I've had treated 3 times. So she explained that first she had pain on biting on a filling, they did a crown. And then she had pain on biting on a crown, they did the root canal. And so 3 treatments, and now she's coming in and she's getting some pain on percussion. And this fracture on the buccal and the lingual, you can see that's stained with caries detecting dye. This tooth is not connected side to side, top to bottom. This tooth is now reinfected, and now the root canal system is infected. And we were able to treat this with biomimetic techniques. this is the idea that previous article that Simone and I published in 2009 in PPAD gave the real ideas that have led to this direct technique. But this direct technique of reducing stress as increasing bond strength, that is a real breakthrough. And so we call that the adhesive equation. And it was first outlined in 1984. In 1984 I met Ray Bertolotti in 1995, so this was written 10 years before. But Ray Bertolotti introduced me to Gary Unterbrink, who I consider my second mentor. And Gary Unterbrink, in a lecture, understood this science and presented it in what we call now the adhesive equation. But basically he said there are things that increase bond strengths, but stress of polymerization in the first time period of polymerizing can stretch and even destroy a hybrid layer. And so there's a competition between shrinkage of the composite and the establishment of the hybrid layer. This is their first paragraph. I called it the adhesive equation. I've been teaching this since 2003 when we first started teaching 6 lessons. Dr. Liebenberg, unfortunately, has passed away in a boating accident in British Columbia several years ago. Gary, as far as I know, he's still alive. I hope. If Ray's had contact with him, I hope he lets us know. But Gary, very, very bright, good scientist. This article, I recommend everybody read that.
Yeah, it's just what Dave was saying before with the other slides. It's if the bonds can withstand the stress, the restorative technique will be successful. Yep.
Yeah.
And then before we start our restoration, we always want to check the occlusal pattern. And as Dave would say also, we always try to do vitality testing to see, look, if you're starting to restore a broken down tooth, you want to make sure of the pulpal status, because you may end up having to do endo prior to restoration of that tooth.
Correct. Yeah, very, very good.
And you'll recognize this slide. It's yours.
There you go. So there's 8 ways to relieve polymerization stress. Use a indirect or semi-direct to take the enamel replacement out of the polymerization shrinkage. And then this is my proprietary concept that I developed that really helps everyone, is that once you seal the dentin, you want to stay thinner than 2 millimeters of restorative material for at least 5 minutes. That makes sure that the bulk of the composite doesn't stress the hybrid layer. So we separate the bond to dentin for at least 5 to 30 minutes. In most indirect restorations where you're replacing quite a bit of dentin, 2 to 3 millimeters of dentin, it will take you more than 5 minutes to do that. If you have a thin restoration, then you can just wait for a few minutes or do another tooth.